Hey guys, me again. I want to talk about the ANA, the American Nurses Association. First of all, I'm not being paid for this. I'm saying that right now. It's a disclaimer. I'm not being paid for this by the ANA. This is my own personal website. Well, not website, channel, and my own personal review of what the ANA is doing. And I'm advocating for them. Okay? Um, You see, it says right here, because your voice matters, become an advocate. These are the things that the ANA is going to be, well, not going to be, but they've been talking about: safe staffing, safe patient handling and mobility, home health, and there's a few more. I want to talk about the first one, safe staffing. I first of all, I want to request that all nurses, LPNs, RNs, APRNs, whoever, nurse anesthetists, whoever, as long as you're a nurse, you fall into nursing. Okay, um, please support the ANA. Become a member. It's not expensive. It's $130 a year. A lot of you can afford that. It's like nothing. Um, please become a member and support them, and just click on this tab right there. It says go, the link, and see where it says take action. You click on that and it pretty much gives you this information here. You fill it out: your name, your address, phone number, whatever. And you see the letter. This is a pre-written letter to, you see it says right there, dear whoever, your name, whatever. All this is going to fill out when you put this information in, and when you hit next step, you're going to see all the names fill in over here. And then there's another one that says send email or whatever. When you send it, it goes to your state representative, your congressman, your U.S. representative. It goes to 3 people. Okay, um, and you should really be supporting this because it's for you. Okay, the ANA is fighting for you. You should also fight for yourself. You fight for your patients because they're helpless. They don't know. That's the whole reason of being in healthcare. You take care of people, right? And we as nurses, nobody takes care of us. We all know that. We take care of our patients. We give them the teaching. We give them the education. We, eat on time. This, that, and the other. And what do? Do we get a bathroom break? Do we eat on time? Do we take our lunches? Do we take a full lunch? Do we get an entire hour for lunch? Do we take a full break? There's always somebody calling. Somebody needs help. Something needs to get done. Something you forgot to do. Or some note you have to write. A medication you got to order. An order you have to place. There's always something. All right. So advocate for yourself. Advocate for more staffing, because we all know what's going on with the hospitals and the nursing homes with money. It's all about cost maintenance and cost effectiveness and cost reduction. It's a business, okay? Before, back in the day, nursing was nursing, where you would actually take care of a patient and, strengthen them, make them get better, help them get better. And you wouldn't discharge them until, they were ready, willing, and able to leave. Now, you come in for 2 days, 3 days, hospital stay, you're out. Hospitals don't keep you. You do your surgery, you have a baby, goodbye, next day, you're gone. Before, they would keep you 2, 3 months, make sure you're good, and then you go. Of course, who's going to stay in a hospital for 3 months? I can understand that with cost effectiveness. However, when you have 30 patients in a nursing home and one nurse to medicate all 30, and it's a rehab floor, and that nurse doesn't have, and that nurse has to medicate and do treatments with a rehab floor. Now you have people there that are on cardiac rehab. They're on there for rehabilitation after hip surgery, BKA, AKA. They have prosthesis. They have, what do you call this thing? Pacemakers put in, just had cardiac surgery. I mean, come on. No way it's possible, okay? So we need to help ourselves, support the ANA. They support us. We should do it too, okay? I'm not going to go too much in depth with it because I have a tendency of getting carried away, and I don't want to say something I shouldn't say. Okay, so you guys need to fight for yourselves. You need to advocate for yourselves. You need to protect yourself, because at the end of the day, the nurse is always the last line of defense for the patient, and you're the one that's going to get the blunt of the force. You're the one that's going to feel the pain, and you're the one that's going to feel the hurt. Because when they suspend your license, or worse yet, in a worst case scenario, they take your license from you, your degree is in nursing. You can't do even mechanic, okay? Because you need to have a piece of paper that says you know how to put a bolt in the engine, all right? So, to clamp the engine down. So, everything in America is black and white. You need a piece of paper to say I can take a hammer and hit a nail. So, if you have that taken away from you, you don't have a job, you don't have a career, you're stuck. Okay, you're pretty much homeless because you can't pay your bills. What are you gonna do? Sell drugs? So support the ANA, get your staffing, get more people on your units to work with you together as a team. In nursing, I believe in working as a team. I believe in working effectively, safely. Okay, and let's do this. Let's advocate for our patients. Let's advocate for ourselves, and let's get Congress to pass that bill and increase the staffing ratios so nobody is gonna be held in reprimand for something that they did or did not do because of exhaustion, because of you know working too many hours or staying over too long or being tired or whatever. Dennis Quaid had a son, and I hope he doesn't get angry for me saying this, but Dennis Quaid, the actor, had a son. I hope that's how you say his name, Quaid. I say Quaid. I don't know if it's Quaid, Quad, or whatever, but Mr. Dennis Quaid had a son, and his son had actually died in, I believe it's a hospital, because the nurse, guess what, was working too many hours, and she made a mistake with the medication. She made an error, and I believe she over medicated the boy and killed him. Okay, and one thing I have to say is that man is an angel because he did not press charges on that nurse. He did not say, "Oh, charge her because she was negligent and she needs to be sued for malpractice because she killed my boy." He was very compassionate and he understood that the nurse was overwhelmed. The facility was short-staffed. They asked her to stay on. They begged her to stay on, and she's like, "Okay." And she made a mistake with the medication and killed the boy. And I mean, I'm not a parent. I can't even begin to understand what it's like to lose a child. However, I do know what it's like to lose a parent, and I can tell you that that man had to have a lot of courage and compassion, to do what he did. He didn't press charges on the nurse. Instead, he took her, I believe, if I remember correctly, nationwide. I think to speak up on the same exact issue, safe staffing. Having not working if you're too tired to work, and having enough people in at the facility to work, and whatever. So I don't think anybody wants to be in that position. We all have licenses. We all need to protect ourselves and our patients, and the best way to do that is by having the very first thing that we see on this page right here. You notice it's not the second, the third, the fourth. It's the very first one. Safe staffing. All right? So let's all be safe. Let's all be, nurses. Let's all advocate for our patients, and let's just work safe. All right? And you guys